Welcome back, everybody. We're going to begin week 9 with chapter 10. This week we'll be doing chapter 10 and 11, the young adult. So, chapter 10 is becoming an adult, physical, cognitive, and personality development in young adult. We'll be looking at that transition from adolescence to young adult in terms of the physical changes, cognitive, and personality. So, we'll discuss what age does childhood end and adulthood begin. And how do young adults maintain good health? How do we carry over those habits? And what changes in intellectual abilities and personality can be observed once a person reaches adulthood? So we're going to talk about those changes and, what makes it different? What does being an adult mean? What are the clarifications in the specifics? So we're going to dive into that now. So now let's take a look at that emerging adulthood. So we're going to examine what role transitions mark entry into adulthood. So are you a student and now you have a career? Are those some of the things? So we're going to see what specific roles would indicate that you're going into that adulthood phase. And how does going to college reflect the transition to adulthood? So all you guys are in college, so you guys should be able to relate to this to see if that connects with your life right now. What behavioral criteria mark the transition to adulthood? And how does achieving financial independence reflect the transition to adulthood? So all of this stuff right now is kind of a lot of as you guys are first time college or you're in your early 20s, this is going to be the stage that you guys are in. So you should be able to relate to a lot of these questions. Extra videos you're going to be having in our lecture, and it's a TED Talk on why does it take so long to grow up? So again, I'll have this posted in the lecture video slide and the additional videos. So in the United States, young people drive a car at 16, they vote or join the military at 18, and they drink alcohol at 21. So what is the age of true adulthood? What roles would you define as being an adult? So they define emerging adulthood, your textbook, as the period between late teens and mid to late 20s when individuals are not adolescents, but they're not yet fully adults. So a lot of times that's this time period that you're in college, that you're exploring a lot of different ideas. You don't have your career path set. You don't have, your job path set. That's kind of that emerging adult. It's the time to explore careers, self-identity, and commitments. These emerging adults tend to still be on your parents' health insurance with the 2010 Affordable Care Act that extends it to 26 years of age. So again, they don't have the responsibility of taking care of their health care if they're on their parents. And also there's biological and physiological developmental trends that peak and the brain development continues in different ways, which we discussed earlier. But we'll kind of discuss how that transitions. Now this is where you're going to start to get that. Frontal lobe's going to start to develop. So we'll dive into that a little bit more as we discuss this emerging adulthood. So now we're going to look at role transitions marking adulthood. We talked a little bit about this at the earlier onset of this as we reviewed this precursor to this chapter. So what specific role transitions would delineate your advancement into adulthood from your adolescence? So we think of that as a rites of passage, rituals marking initiation into adulthood. They're especially common in developing countries. They may involve special dress, sometimes involve religion. In most cultures, marriage is most important. Can you think of some that you have experienced in your life or your culture or you in the United States we see? One of the things that your book emphasizes is that they may involve elaborate steps that may take days or weeks in these to complete, or they can be compressed into a few minutes. Western cultures, we think a lot of weddings, graduations, maybe Catholic confirmation, Judaism, bar mitzvahs, the Hispanic culture, quinceañeras. The reason that marriage is considered in most cultures because it's a precursor to childbearing, which is a clear evidence to adulthood. Now, if we take that marriage and we think of it as a role transition, marriage now from marriage, in the 70s is a lot different. What can you think of the time frame if you're going to think about when people get married? So we actually get married later. So if we waited till we got married as a role transition to mark our adulthood, we'd be way into our late 20s. So that might not necessarily be the best role marker into emerging adulthood because our culture has changed. So the average age to get married in the 1970s was 22 and 24. 22 for a woman and 24 for a man. Now the average age is 27 for a woman and 29 for a man. So again, that's not really a great indicator for marking your transition into adulthood, because by that time you should have other markers that have transitioned you into that. And marriage is not one of those, necessarily precursors. Not valued as you don't have to be married to be an adult. I guess now, back in maybe the 70s, that was kind of different. A little attitudes were different. But now we don't think that way. We don't think, oh, if you're not married, you're not adult. So as values change or perceptions change, sometimes these rites of passages may change. And so one of the things I want you to remember is that Western cultures, they use this idea of role transitions. And it's a criteria where you decide, when do you reach adulthood? So it's that act of assuming new responsibilities and duties. So as you can see listed in the slide, common ones are voting, obtaining full employment. They talk about getting married. What can you think of some other ones? So there's talk right now of, changing the voting to 17. Do you think that they're an adult enough to vote? Lots of things to think about. So when you're thinking about this rites of passage, you want to think of these role transitions marking adulthood, and think of what roles or special ceremonies that would mark that transition from an adolescence into adulthood. And just remember, Western culture has a lot of role transitions, the act of assuming these new responsibilities and duties. It will be in your additional videos, and it's going to show the rites of passage, a girl's journey to womanhood from a non-Western culture. So I want you to watch this and to compare that to what we in the United States would consider a rite of passion, and what this culture would be that is not Western considers a rite of passion. And you want to say, do you agree with it? What are some of the similarities? What are some of the differences? Rites of passages depend on values of the culture and society. So if we look at what does our culture value that influences our rites of passage, opposed to what this culture values in other cultures, across the world. So it's interesting to think about, it's definitely based on our values and what we deem important, and what marks that adulthood, so that role transition. So definitely watch this, and I want you to compare Western and non-Western rites of passage. So another role transition or rite of passage that you guys may have came up with was going to college. So is going to college a way to transition to adulthood? Well, nearly 70% of U.S. high school graduates go straight to college. And we'll look at that figure on the next slide in a moment. And they found that advances in intellectual development and identity cause a student to act and think like adults. So there's a lot of things that would say going to college, is going to teach you how to be an adult. You have responsibility, you're thinking higher, intellectual, maybe problem solving, critical thinking. But does that paint the whole picture? What they found is that most college students are not using college attendance as a transition to adulthood. Majority are adults over 25, returning students, and that means they have already reached adulthood. They've already had life experiences and other role transitions, being, having a job, having to take care of themselves financially, etc. Maybe being married, having a family. There's a lot of different things that can get you to be an adult by the age of 25. So they're finding that, even though that 70% of U.S. high school graduates go straight to college, that doesn't mean that they finish or they don't leave and come back. So they're finding that it's not a true indicator of your emerging to adulthood. So just because you go straight to college doesn't mean you're going to suddenly turn into an adult. What they have found is that newer students, 18 to 25, it can be a transition to adulthood. So it definitely can be if you stick through it and you go straight through 18 to 25. However, if you're coming back after 25, it's not a transition to adulthood because you're already adult coming back to college. So it just depends on what stage of life you're at and what you're experiencing. So what this figure looks at is enrollment rates of 18 to 24-year-olds in degree-granting institutions by race and ethnicity, 1975 to 2012. So if you look at, so the red is high income, the green is middle income, and the purple is low income. So you can see that the lower your income, the less likely you're going to be enrolled in college. Now, all of them, if you look at 1975, all of them, were lower, and they improved. It looks in the 90s, and then kind of peaked in the 90s a little bit, and then have gotten definitely better for high and middle income, and went down a little bit for lower income, but overall better. So overall better if we looked at it from 1975, we're definitely having across the board more 18 and 24-year-olds enrolling in college. But you can see definitely the higher your income, the more likely you're going to enroll, over 80% opposed to, 50, a little over 50% for low income in 2012. So if only 50% are enrolling in college, then that definitely does not necessarily mark a transition into adulthood. It can play a part of it depending on where you are in your life and, if you're 18, 24. But again, going to college is not necessarily guaranteed role transition into adulthood. So now let's take a look at behavioral changes in the emerging adult. Young adults decrease their engagement in risky behaviors and edge work. So why do young adults decrease their engagement in this risky behaviors? We've been talking about this all throughout the teenage brain, right, the adolescence. Right, because when they come into that, emerging adult in their mid-20s, early 20s, that frontal cortex is starting to fully develop, and their reasoning, their logical reasoning, and their ability to stop these risky behaviors develops and balances out with the limbic system. So what is edge work? Edge work is a desire to live life more on the edge, though through physically and emotionally threatening situations that are on the boundary between life and death. So that's that adrenaline rush. So do you know people that just have to have this like constant stimulus, like life has to just always bring them, almost at the height of like life and death situations to be engaging. So that tends to happen more in that adolescence, which we talked about, and this starts to decrease as you get into young adulthood. So you're going to see significant drops in driving at high speeds and significant drops of unprotected sex or extreme sports or committing antisocial acts like vandalism. So that you're going to see that maturity of the brain and that prefrontal cortex start to inhibit some of those behaviors. And again, remember, some evidence that the prefrontal cortex is not completely developed until the mid-20s. So that could be all the way up to 25. So depending on the maturity of that individual person, you're going to see a variant in those behaviors. But this is when it starts to turn. And also they found through research that engaging in risky behavior is associated with living in poverty, because if you don't have, again, we've talked about this, if you don't have the basic needs met, then your hierarchy of taking care of yourself and being responsible and is low on the totem pole. You're just trying to survive, and sometimes just trying to survive is risky in itself. Another thing I want you to remember is that that So I want you to remember that some research argues that risk-taking behavior, and this is in males, so mostly in males, does not vary between young and middle adults in the same socio-demographic conditions, such as if you control poverty. It's more likely that poverty is stronger correlation to risky behavior than brain development. So at this stage, basically what they're saying is that if you have if you have two socioeconomic groups of males and you put them in one's in the poverty and one is not in poverty, they're going to say their brain is about the same. So the ones in poverty is more of an indicator if they're going to do risky behavior than the brain, since the brain is probably about leveled out to about the same, and their environment is going to cause more of the risky behavior than the biological or the brain. So you want to remember that as well. One of my additional videos, it has good information on the development from adolescent to adulthood and the importance of the prefrontal cortex. So it's a great little short video to review all that and to understand the new emerging factors in the brain development of the emerging adult. Picture of Erikson, our guy that we've been going through this journey of development. And the next stage is intimacy versus isolation. And this is a really good video of him actually describing it himself. So this is from his mouth, the developer's mouth. So after you watch this, I want you to think that if what he says holds true in today's society, and what ideas do you think are correct and what maybe are not as black and white. So I want you to watch this video and just think intimacy versus isolation. And is he holding those behaviors still hold true in today's society? So let's now take a look at Erikson's stage of establishing intimacy versus isolation, which takes place in young adulthood. So Erikson believes that a major task for young adults is intimacy versus isolation, and this is the 6th step in his theory of psychological development. So what he found is that what he believes is that once a person's identity is established, so remember how we talked about in adolescence how they're searching for that identity, they're trying out a lot of new things, kind of carries over a little bit in the first part of adulthood. So basically he's saying once you've found that identity, so you're that's the crisis in this stage, versus that identity confusion. Remember that what you're going to relate yourself, who you're going to be. Then he or she is ready to create a shared identity with another. So that would be intimacy. So he believes you have to have that identity of yourself before you can share intimacy with another. And the key ingredient for intimacy, he believes, is that without a clear sense of identity or self, adults are afraid to commit to long-term relationships or be overly dependent on partner's identity. So they're either afraid to commit or they'll just start to take on their partner's identity. So do you know people like that? Have you seen that in relationships? Have you been in a relationship like that? So basically he's saying either if you do not have a strong sense of your own identity, you're going to be too afraid to commit, or you're just going to take on the role of the other person's identity. And through research, Montgomery had found that a stronger identity was related to higher levels of intimacy. So they have found that. But there have been conflicting evidence for supporting this theory. Arseth and colleagues found that conflicting results occurred because men and women resolve intimacy issues before identity issues by marrying and rearing children, and only later do they deal with questions of their own identity. Middle-aged women who goes to college for the first time is an example. So what they're saying is that you don't always solve your identity before you reach intimacy, and gender differences play a huge factor, right? Women will tend to be more intimate, have more relationships and solve intimacy issues before they are going to maybe take on their true identity, because maybe they're a mother and they're a wife and they're doing all those different roles. And until they hit, like that example, that middle-aged woman who maybe doesn't have those responsibilities of being a mother, has more free time, is going to go back to college and find a new identity. She's going to be a college student now. So it doesn't always play out in that clear cut, I know exactly who I am, so now I can find a partner. Sometimes we're evolving and growing, And we seek out, different forms of relationships depending on, where we are in life. So what they found is Erikson's theory is partially right, but you don't have to be perfectly have full self-identity, is what the conflicting research has shown, to be able to have these intimate relationships. So do you think that's true? So that's what Erikson believes. So if you were going to argue Erikson's, you would say, yes, you have to find your self-identity before you could be intimate with another. Do you feel like that? Do you have to completely know yourself before you can commit? Or is there still room to evolve and find identities together or as you get older? So something to think about. So one way many people would consider transitioning into adulthood would be able to launch yourself with financial independence. So if you could financially take care of yourself, pay your bills, buy your groceries, take care of your medical expenses, then you're definitely becoming an adult. So young people who do not go to college often become financially independent sooner than others. They get a job that they have to take care of themselves, and they have to devote to that. So that idea of going to college, again, is not necessarily a role transition for everybody to become adulthood. Going and getting a job and becoming financially independent is also a way. And in fact, it leads to adulthood sooner because you tend to have to take on financial independence sooner. This is increasingly common for college graduates to move back in with their parents. So I know this is maybe a little older movie, but that movie Failure to Launch with Matthew McConaughey, about him moving back into their parents, and that whole phenomena of college students having to go back. And I feel like it's definitely, I've seen it more with college being so expensive and you're not necessarily finding the jobs that you want. Having to go back to your parents because you have such huge loans, and not being in the careers that you need to be or you want to be, or finding that niche or success, a lot of students are going back, or graduates are going back to live with your parents. So what do you guys think about that? Do you think that's a trend now? Have you had to move back with your parents, or when is it okay and when is it not? And if you do move back in with your parents, are you still considered an adult if you graduated from college, or are you an emerging adult? Those are some ideas to think about. And living on one's own accelerates the process of becoming an independent adult. So when you live on your own, you have to take care of every aspect of life. And that's kind of what being an adult is, right? You have to make sure your bills are paid. You have to make sure you get up on time. You have to make sure that you financially can take care of your rent, your car, your health, all that stuff. So it accelerates it. So what they found through research is that 1/3 of high school graduates who do not go to college and those who do not finish high school will face this financial independence earlier. They may find a niche, a part-time job, full-time employment. They may learn a trade or start their own business or join the military. So research in Western culture shows clearly that living on one's own accelerates the achievement of adulthood, whereas living with parents slows it down to become an independent adult. So what do you guys think? Idea of, striking it out on your own sooner, and the idea of, when you come back and live with your parents. How do those two pathways and that role transition and those rites of passage lead to an adulthood? Can you think of the similarities and the differences? So now we're going to transition into physical development and health. So what respects are young adults at their physical peak? How healthy are young adults in general? How do smoking, drinking, alcohol, and nutrition affect young adults' health? And how does the health of young adults differ as a function of socioeconomic status, gender, and ethnicity? So we're going to take a look at all that. So now, do you feel like you're at your peak in your early 20s to mid 20s? Do you do things that may hurt or may damage your body that in your middle age to late adulthood you're going to pay for? So we're going to kind of look at in what respects are young adults at their best physical peak. So emerging young adults are in their best physical shape of their lives. They have trouble-free reproduction. They're at their peak athletic. They have they're at best at strenuous work. They achieve their max height. And all this kind of peaks in the late 30s. And once you hit your late 30s, it all starts to decline. So there's a saying that once you hit 40, things just start breaking down in your body. So there's a kind of little truth to that stereotype. So you want to remember physical strength, coordination, and dexterity are at their peaks in the late 20s to early 30s. They even found this way, I know with some cyclists, that they actually do better in this time because they're peaking in their endurance, their strength, and their coordination. And that athletes tend to have this kind of that late 20s, early 30s is kind of that peak athletic performance. And think of your professional athletes. So if you start to hit your late 30s, you're considered almost over the hill, and some even earlier depending on the sport. Another thing you want to remember is that sensory acuity peaks in the early 20s. Visual acuity remains high until middle age, so that's your ability to see. So usually, as if you've noticed, maybe your parents or I don't know if anybody over 40 in the class, that you start to look at your menu and you have to take it away from your face because you can't see up close. So not being able to see up close is a aging process. So everybody eventually, if you live to 120, would be able to see up close. It's an aging process of your eyes, and usually starts to hit in middle age, even to some people in their 40s. Hearing tends to decline by the late 20s, especially for high-pitched tones. So those really high tones. So even some letters, S's, T's, they hit the way you say them, hit the higher tones. So that's where you might find that some words are harder for to hear as you get older. And again, in middle age, you tend to be farsighted, which means not being able to see up close, and you need glasses. And then athletes in their prime, in their 40s, are definitely an exception to the rule. So remember, peak, late 20s, early 30s. Think of that endurance cyclists. Think of the Tour de France. They're at their peak. And late 30s, they begin to decline, not only in physical strength, coordination, and dexterity, but also visual acuity. So think of that menu where you need those glasses to see up close. And then their hearing starts to go down, and especially those high-pitched sounds. So, are young emerging adults healthy or not? They're at the peak of their health, right? They rarely die from disease. Accidents are the main cause of death for Americans aged 25 to 44. Men ages 25 to 34 are 2.5 times as likely to die of accident as are women of the same age. And we know this because we've learned this throughout, that men tend to do more daredevil type activities. They're more likely to speed, maybe more likely to drink and drive, just from the makeup of their brain and their decision making. They've also found through research that African American and Latino American men are 2 to 2.5 times as likely to die in accidents as European American men. And Asian and Pacific Islander American men have half the rate of accidental death as European American men. So those are interesting figures, and to dive in to really delve and see why. Some of it has probably a lot to do with we've already talked about between environment, culture, socioeconomic, all those factors, genetics, all play a factor in everything we do. But definitely you can see, why that is the cause. You definitely have to look at more of the research to find out. So another thing that causes, death in young adults or emerging adults is lifestyle factors. So as you can see, one of the biggest ones is smoking. Smoking causes several risks. We'll take a look at the next figure, but roughly 440,000 people die each year from smoking-related illnesses. And breathing secondhand smoke is also a very serious risk. So the best way to maximize your odds of being healthy is don't smoke. Monitor your alcohol consumption and eat a well-balanced, nutritious diet. It's basic common sense there, right? Smoking is the single biggest contributor to health problems. Smoking-related illnesses cost roughly $100 billion annually. That's insane, right? That's a huge number. So we see it. I see it all the time in working at the hospital. So many lung cancers that I see where their lungs have to be part of their lung has to be removed. At least definitely see those patients every week there. So definitely one of the major biggest contributors to health problems. But if you quit smoking, you can definitely have an impact and can improve your health. Quitting smoking has many benefits. The lungs remain normal functioning in approximately 1 year, so it takes about a year for the lungs to come back to normal. And your risk of stroke and heart disease returns to average after 15 years of being smoke-free. So if you quit earlier enough, you can reverse a lot of the damage that smoking has caused. Another thing they found with smoking is that smoking during one's lifetime has a small but measurable negative impact on cognitive functioning in adults over 50. And another thing they found is 90% of people that stop smoking on their own, 2/3 and 3/4 who stop smoking start up again in 6 months. So that's a lot. So a lot of return rate back to smoking. I don't know if any of you guys smoke or if you quit and come back. I've known patients and family members that it's very, very difficult, right? It has an addictive nicotine in it and all the stuff that the cigarette companies want you to stay using their products. So definitely high relapse. But so that's what they're saying. If you stop on your own, you're more likely to relapse than if you had help, like a nicotine patch or going to some kind of smoking cessation program. So just remember that 90% who stop smoking on their own, about 66 to 75% start up again within 6 months. Will be in the additional videos, and it's a great video. It shows exactly what your body can and how your body can heal and recover when you stop smoking, and it definitely is encouraged that it's never too late. So watch this in the additional videos. So this figure shows the lifestyle factors that smoking can damage every part of the body. So you can see cancers of the head, neck, lung, leukemia, stomach, kidney, pancreas, colon, bladder, cervix. That's tons of cancer, so just lung cancer. And then chronic diseases of stroke, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, chronic lung disease and asthma, reduced fertility, and more likely to have hip fractures. So when you see that patient and they say they have a history of smoking, I want you to picture this guy and think these are all the possibilities that could be going on in his body. So a lot of times we just think of the lungs, but it definitely affects the whole body. So now we're going to take a look at alcohol. 2/3 of people in the United States drink alcohol at least occasionally. Most people, alcohol poses no problem as long as you don't drink and drive and you drink responsibly. Moderate drinking is linked to a 25 to 40% reduction in risk of cardiovascular disease and stroke. So like when they tell you, drink some red wine, it'll help with your heart disease. So there definitely is some benefits of drinking. 1 to 2 glasses of beer and wine for men per day, 1 glass for women, can actually help, with cardiovascular disease and stroke. So it's a problem when it becomes, more than moderate drinking or minimum drinking, that's when you begin to have, these repercussions from drinking. One of the big things is binge drinking, and that definition of that is consuming 5 or more drinks in a row, and that's for men, and 4 or more in a row for women in the past 2 weeks. And binge drinking is a major health problem in the United States since 1990. And one of the big things why there's different numbers between men and women is because because men and women tend to be different sizes, and they metabolize alcohol at different rates. So it only takes 4 drinks for a woman where it would take 5 for men. So we're going to take a look a little bit more at binge drinking, but just remember that, drinking in moderation is, can actually have some healthy effects of reducing cardiovascular disease. 1 or 2 glasses of beer for a man, 1 glass for a woman. And as long as you don't drink and drive, most of the time alcohol doesn't possess a problem. It begins to become a problem when you're drinking excessively, and one of those ways is binge drinking, and we're going to take a look at that on the next slide. So binge drinking is common among college students aged 17 to 23. So a lot of you have probably seen binge drinking or been a part of binge drinking, or if you're older like me, you've seen it as well. But this definitely hits this demographic that, is college age 17 to 23. It's seen among college students. 1,800 U.S. college students between ages 18 and 24 die annually as a result of binge drinking. Women are more likely to exceed guidelines of weekly alcohol intake, and it takes less alcohol for women to experience deterioration of judgment and behavior because they metabolize alcohol differently. They usually weigh less, so it metabolizes quicker. The connection between alcohol and sexual assault. So this is a huge thing. So when we think about when women are more likely to exceed guidelines of weekly alcohol intake, and if they're put in positions where, and they have a decreased, it takes less alcohol for women to experience this deterioration of judgment, and maybe they're at a party or they're in the mixed company. A huge, connection between alcohol and sexual assault in this demographic. About 100,000 college students annually are victims of alcohol-related date rape, and about 700,000 are assaulted by a student who has been drinking, and over 1,800 young adult college students die from drinking too much. So just think about that. 700,000 are assaulted by a student who has been drinking. So alcohol and this, sexual assault plays a huge factor because it alters both persons' judgment. And this number might even be low because sexual assault rates tend to be low from victims not reporting incidents, especially if they've been drinking and they feel like their testimony is not going to be reliable. So one of the huge things for binge drinking during this age is that lack of or deterioration of judgment and behavior from the woman and the man. So definitely a huge problem, or can potentially be a huge problem in this age group. So this figure shows that troublesome behaviors increase with binge drinking, and that all binge drinkers report more problems than do non-binge drinkers. So you can see in the red is the frequent binge drinkers, the green is the infrequent binge drinkers, and the non-binge drinkers is the blue. And you can see right away that every single category, the red at least doubles the infrequent, and triples the non-binge drinker. That's from getting a hangover to getting in trouble with the police to engaging in unplanned sexual activity. So straight across the board, you can see, frequent binge drinking impairs your decision making and causes these troublesome behaviors to increase. So definitely a problem if you are a frequent binge drinker. It will be also in your additional videos, and it's a very short video that highlights all the key elements and repercussions about being a binge drinker, and a great way to remember it for the test. So what can colleges do to make an effort to reduce binge drinking? Since this is a huge problem in this demographic and can lead to a lot of repercussions for the institution and for the students there. So first thing they can do is have an intolerance of antisocial behaviors. They can educate fraternities and sororities on what we talked about in adolescence is even that dating violence, preventing sexual assault. Your workshops that you are working on for the last week's discussion are great examples of that. provide non-alcoholic activities for students, etc., right? Create an environment and an expectation that this is not okay and that it'll be not tolerated, especially to the incoming freshmen. So set that campus culture that binge drinking is not going to be tolerated, and then give them alternatives to it, and repercussions if it's not. Give the students a safe place and a safe alternative. 8% of adults 18 to 24 and 5% aged 25 to 44 are considered heavy drinkers. Men and European and Native Americans are most at risk, according to research. So we talked about binge drinking. Now let's look at alcoholism. So alcoholism is a form of addiction. And it's what its definition, according to your textbook, is physical dependence on a substance accompanied by withdrawal symptoms in its absence. So dependence occurs when a drug, such as alcohol, becomes so incorporated into the functioning of the body's cells that the drug becomes necessary for normal functioning. So it almost takes over what your normal cells do. It kind of replaces them. So when you don't have them, the body forgets what it normally used to do. And that's why they have those withdrawal symptoms. And I'll tell you, working at the hospital, we probably have, at least 5 patients on our list, daily that come in with alcohol withdrawal. It's we see a huge problem in Kern County. So I see it every day. Neurotransmitters, gamma aminobutyric acid, which inhibits impulses, glutamates, which excites the nervous system, and norepinephrine, which is released in response to stress, and dopamine, serotonin, and opiate peptides, which are responsible for pleasurable feelings. So all those neurotransmitters that do all the jobs of the nervous system are replaced by the alcohol. And when you don't have that alcohol, so the body just stops producing it or doesn't produce enough that you normally would need to feel that, and alcohol replaces it. So when you take that alcohol away, the body is so depleted in those neurotransmitters that you go through those withdrawals. So the person may crave alcohol to restore these neurotransmitters, which have been depleted, to feel good again or avoid negative feelings. The body does not have enough of its own to feel good again. So you're going to feel really not only physical withdrawal, you're going to feel that drop because you got that drop in serotonin, opiates, dopamine, those feel-good receptors, that you're going to feel that, negative feelings again, and then you go back to drinking. So it's definitely a dependence that your body physically and biologically gets addicted to. Other factors include genetics, high stress, anxiety, or emotional pain, close friends or partners who drink excessively, and sociocultural factors that glorify alcohol. So if you're around a place that, promotes alcohol and you see it on TV and then you're with friends who drink, and all this stuff can, again, make it hard not to become dependent on alcohol. So it's very difficult to treat alcohol addiction. Most programs such as AA promote abstinence. So most people seek treatment for their first time are in young adults. They are in inpatient, outpatient, maybe some medications, including research. So research has shown that gabapentin, which is a generic calcium channel gamma aminobutyric acid modulating medication, so some kind of medication with the neurotransmitters, has been effective at treating alcohol dependence. So if we're thinking about neurotransmitters, sometimes giving medicine that replenishes that's not alcohol can help, because it can treat the alcohol dependence and relapse-related symptoms of insomnia, dysphoria, and craving, and the cravings are just some of the few side effects. Little is known about the long-term success of these various programs, so that's why treating alcohol is so difficult, because there just isn't proven research that one program works. Some are shown to definitely getting help, AA, learning how to just stop drinking, and some of these medicines have shown the help, but there's just not enough to know the long-term success. So they need those long-term studies, right? Those longitudinal studies. If you're having side effects of some of these relapse-related symptoms of insomnia and cravings, then do you stick on the medications that are trying to help. So is the side effects worse than the actual drinking? So definitely a lot more research needs to be done in it. And just know for the test that, it's difficult to treat. There's drugs for the neurotransmitters to replace what the alcohol has depleted. And then that the AA, which is the most common when you think of alcohol, Alcoholics Anonymous, that they promote abstinence. So let's take a look at nutrition during this emerging adulthood. Nutrition directly affects mental, emotional, and physical functioning. So you probably know if you're hungry, you may be angry or be short-tempered. They call that hangry. So definitely, nutrition has a definite effect on your mental, emotional, and physical functioning. If you don't have enough calories, if you're not eating, you may pass out, or you just feel lethargic. Another thing to consider is your metabolism, and that's how much energy the body needs. So it slows with age, along with the digestive process. So you're going to have your best metabolism as a child, and into adolescence and a young adulthood. And again, as you start to age, that metabolism slows because you're not needing to grow. You don't need as much calories, so sometimes it's hard to switch that off. Like if you have a diet and you have higher calories, and now your metabolism is slowing down, but your calories haven't changed, you may have shown that you've gained weight. And how do you change those eating habits? The digestion used to be the process as you were younger. You could break down food faster, so you get your digestion faster. You're hungrier faster, so the digestion actually slows down. So you shouldn't be hungry as often. So all that stuff changes when you age. And the USDA and the American Heart Association have guidelines for a healthy diet, and we'll be looking at that in the next slide. But just remember, diet has been linked to cancer, cardiovascular disease, diabetes, anemia, which is low blood count, and digestive disorders. So people mature, nutritional requirements and eating habits change mostly due to metabolism. So that's the big change as we age. Our metabolism slows down, so our eating and habits need to slow down as well. So the USDA depicts a healthy diet by showing the relative portions of various types of food that should be eaten. So it's called choosemyplate.gov. So you can go to it and look at it. And so you should see the proportions that you should eat. So you can see vegetables and grains have a higher proportion than fruits and protein, and you can see dairy is the smallest. So that's to show just an easy way, a visual guide to healthy eating by showing that relative proportions of various types of food. So you don't have to count calories. You can just kind of break your plate up and do a smaller portion. So it's much easier to remember and therefore actually follow through. So what they want you to make sure you remember is that you eat less, making half the foods fruits and vegetables, half of grains eaten are whole grains, and that fat-free or low-fat milk, lower sodium, and drinking water are the ideal proportions for a healthy lifestyle. Of the videos that will be in the additional videos, and this is just how they came together on how to create a healthy plate, and watching this should completely understand it for the test. So what is the recommended diet? They found that a diet low in cholesterol is important for preventing cardiovascular disease. So developing these habits in a young adulthood is going to carry over into late adulthood, middle adulthood, so definitely wanting to start these at this age. What they found is that lipoproteins, these fatty chemicals that are attached to proteins that are carrying the bread. Low density lipoproteins, that's the LDL. So you may have heard of good cholesterol and bad cholesterol. So your low density lipoproteins cause fatty deposits to accumulate in the arteries. And so those are your bad cholesterol. And those high density lipoproteins, which is your HDL, they help keep the arteries clear and they break down the LDL. So that's your good cholesterol. So when you think of bad cholesterol, think low, bad things go down. That's your bad cholesterol, and that causes the deposits, the plaque. And when you think of good cholesterol, think high, good things go up, and that keeps the arteries clearing. So what can you do? Exercise and a high fiber diet can improve your LDL, HDL ratio, and statins. So that's what you guys, all you future nurses are going to learn about statins, a huge thing that medicine that they use for cholesterol. Definitely a huge one they use for stroke protocol. and it controls cholesterol levels, but remember, it does have side effects. So just some reminders. The American Heart Association recommends that food high in saturated fat, which would be considered ice cream, should be replaced with foods low in fat, which would be like fat-free frozen yogurt. And the main goal of eating this diet is to lower cholesterol for cardiovascular disease. And like I said, HDLs are the good cholesterol, and the most popular medicines to control cholesterol is in the statin, which you may have heard of or may even be on, is Lipitor, Zocor. And what they do is they lower the LDLs and they moderately increase HDLs, but some of the side effects, it can involve some of your liver function. So again, nothing is a perfect cure. The best thing you can do is diet low in cholesterol and preventing those. Another video. This is a really short video that explains good cholesterol versus bad cholesterol and gets some great illustrations for you to see. So as we talked about with adolescents, obesity, again, is one of the growing health problems in adolescence to young adulthood to middle adulthood. Seeing it much, much more prevalent in the hospitals that I've seen. And it leads to many, many, cardiovascular disease, diabetes, hypertension, all those things, early onset of all those things. So what is obesity? So obesity status can be assessed by computing the body mass index, which is the BMI, and that equals your weight divided by your height squared. So BMI is a good ratio of body weight and height that is related to total body fat. And what they considered a good BMI is 25 for a healthy weight. So have you guys had done your BMI? Are you in the healthy weight? Do you think that's a really good indicator? What other indicators have you learned about to determine obesity? So this is a classification of overweight and obesity by BMI, waist circumference, and associated disease. So you can see a normal is BMI is 18.5 to 24.9. And then you can see overweight is 25 to 29. And then if you are in that BMI, you have an increased waist circumference. And again, you can see obesity and extreme obesity. Again, one of the physical demonstrations of heart problems when you carry your weight in your abdomen. That's a really big indicator of possible heart problems of where you carry your weight. So having that's why they look at that waist circumference, because if you're carrying a lot of your weight in your abdomen, you actually have an increased risk of heart problems. So that's why they look at it, not just your BMI. They look at your waist circumference and your weight. So you can see that as that BMI goes up, both of those tend to go up as well, increasing your risk for type 2 diabetes, hypertension, and again, heart problems. So let's take a look at social, gender, and ethnic issues in health. So the most important social influences on health, we think about it through all the lectures we've gone through so far, is your socioeconomic status, right? Is your availability to have education on nutrition, health, have access to health care, all that stuff. So if you have a higher socioeconomic status, you tend to have better access to all those things. So it predicts whether or not people have good insurance and health care, they're educated on proper nutrition, they feel safe, they can take care of their children, So poor inner city neighborhoods have the worst health conditions because they have the worst socioeconomic status. They're just trying to survive instead of thriving. And when you're just trying to survive and you don't have resources for that good health care or education on healthy lifestyle, it becomes very low on your priorities when you're just trying to make ends meet and survive every day. So statistically, what they found is that your risk of dying increases as educational level decreases. So education predicts a healthy lifestyle and avoiding certain diseases. So The quality and quantity of outcomes is poorer with lower educational levels when looking at specific diseases such as rheumatoid arthritis. So they can even look at predictions on your socioeconomic to particular diseases. But remember, education does not cause good health. Rather, educated people are in a position where they know about how to take care of their health better. So just think of that little pyramid of like when you are in a lower socioeconomic status, you're just trying to survive. And because you're trying to survive, you cannot thrive, and you may not have the knowledge or the resources to have good health care, the time to get good health care, or the ability to buy healthy foods, have access to healthy foods. They may not even be in your neighborhood, or even know what is healthy and what could cause long-term problems. So education does not cause good health. It's just rather educated people are in a position to know about how to take care of their health better because they don't have to worry about surviving, so they can thrive. So internationally, we see some differences in gender associated with healthcare. For example, women in some cultures are not allowed to travel alone to attend clinics. So if they're not able to do that, maybe they don't have access to healthcare as readily, and they may misdiagnosis or may not be educated in ways to take care of themselves. So now let's delve into the cognitive development of the emerging young adult. So we talked a lot about intelligence and IQ from adolescence and IQ testing. So what does intelligence look in adulthood? What are primary and secondary mental abilities and how do they change? And what are fluid and crystallized intelligence? So we'll talk about what those are and how do they change. So let's take a look at the cognitive development of the emerging young adult. So we're going to ask the question, how has neuroscience research furthered our understanding of intelligence in adulthood? So if you remember early on when I talked way back in chapter 1 and we talked about, when we think about these psychologists who developed these theories, they didn't have necessarily this technology to support their ideas. So now that we have such high-tech neuroscience and we can see the brain when they're, having people are acting out or having these thought process, what does that do to understanding how intelligence is formed in adulthood? We're going to look at what is post-formal thought and how does it differ from formal operations, and how do emotion and logic become integrated in adulthood? So the question we're going to ask is, how should we view intelligence in adults? So what constitutes intelligence in adults? So most theories of intelligence are multidimensional, means they're just not one straight idea. They identify several types of intellectual abilities. Multidirectionality, some aspects of intelligence improve and others decline. Right? You can get better in one area and decline in others. Aspects also vary from person to person, known as inter-individual variability. So one person might be, have intelligence in this, and another person might have intelligence in other areas. And we talked about this idea of plasticity. Remember the ability for the brain to modify and change, learn new things. So that ability can be modified under the right condition at any point in time. So I use this idea all the time when I'm treating patients, as I'm really tapping into this idea of plasticity. Where can I find those connections in the brain to form, to modify and change so I can get this activity back? So same thing cognitively and intelligence. How do we grasp onto those that plasticity so we can create the right condition to form this and maintain this intelligence? So you have some of your psychologists in your book, Sternberg, who emphasized multidimensionality in his theory of successful intelligence. Baltz, Lindenberger, and Staudinger also introduced three other concepts as vital to intellectual development in adults, and that was multidirectionality, inter-individuality, variability, and plasticity. So those are the ones behind that. And just remember that multi-directional, over time, some intelligence improves, some declines. You have that inter-individual variability. Patterns of change vary from one person to another. So one person might, decline at a different rate than another person. And again, plasticity is not fixed, and you can change cognitive abilities if you place the person under the right conditions. This will be in your additional videos, and recall from the slide before, I talked about Sternberg's successful intelligent theory. And that's understanding that intelligence is just not one-dimensional. That's that multi-dimensional theory. It has many components of memory, emotion, etc. So this video is going to really show you what he means by that multi-dimensional intelligence theory. So definitely watch this to understand for the test. So now let's take a look at primary and secondary mental abilities and how that interacts with their theories of intelligence. So primary mental abilities are the groups of related intellectual skills. So you kind of group your skills into, your skills into a group. And they've identified 25 primary mental abilities. Some examples are your memory or your spatial ability. And then you have these secondary mental abilities. And so these are just a little subgroup. So if you have memory, you might have a little subgroup of memories of these secondary mental abilities. And they're related to your primary mental abilities, and they're clustered into approximately 6 broader skills. And theories of intelligence emphasize that these clusters of related primary abilities are the framework for describing intelligence. So, like I said, they've identified 25 primary mental abilities. And we're going to take a look at 5 of these 25. So one would be basic skills underlying our mathematical reasoning. So are the way that we look at numbering of, that's a basic skill for mathematical reasoning. Word fluency, which would be how easily we produce verbal descriptions of things. Verbal meaning would be our vocabulary ability. Inductive reasoning would be our ability to extrapolate from particular facts to general concepts. And spatial orientation, which would be our ability to reason in the 3-dimensional world. So you could see those 5 primary mental abilities. If we are very successful in them, you could see that we would be intelligent people because we would understand numbers and mathematical concepts. We would be able to describe things easily. We'd have great word fluencies. We could picture the meanings of those vocabularies. We'd have a broad vocabulary. We could reason and take facts and have ideas from them. We could take a group of facts and actually make a concept from them. And then we could understand the world around us, this 3-dimensional spatial. So if we have great abilities in all those, our intelligence, how we see the world, communicate with the world, understand the world would be very high. So this figure here shows primary and secondary mental abilities. So remember, secondary mental abilities reflect several primary mental abilities and their respective measurements. And you can see that you have a secondary mental ability, which would be crystallized intelligence, which we'll talk about in a little bit. Primary mental ability, you can see verbal comprehension. We talked about that, and that would include vocabulary and similarities. And then another primary mental ability would be evaluation, social translation, social situation. So you can see it's taking these primary mental abilities and putting it into a secondary mental ability. And it's hard to discuss intelligence by focusing on separate abilities. Theories of intelligence emphasizes clusters of related primary mental abilities as a framework for describing intelligence. Secondary mental abilities are not measured directly. So just remember that it's a cluster of all these that make up your intelligence. They don't take and look at it individually. So let's take a look at fluid and crystallized intelligence, because that sounds crazy, right? What does that mean? So fluid intelligence is the ability that make people flexible and adaptive thinkers. It allows them to make inferences and enables them to understand relationships. Relations among concepts includes inductive reasoning and abstract thinking. So Fluid abilities you need to understand and respond to any situation, but especially new ones. For example, what letter comes in the sequence if I gave you DFIMRXE? So could you have that abstract thinking and be able to see that next letter? So it's that fluid intelligence you're thinking is always changing, being able to, predict the next item or what's going to be said next, or you get that abstract thinking. So think of that fluid intelligence in the moment. You're changing depending on the situation. You're coming up with a hypothesis kind of in your mind. Crystallized intelligence is knowledge acquired through life experience and education in a particular culture. So they use the example here, Jeopardy test crystallized intelligence, right? It's facts. When you think of that, you're thinking a breadth of knowledge. So what you're learning in this class, all your anatomy, your physiology, that's all laying down a foundation of crystallized knowledge. It's acquired through life experience, through reading and educating yourself in culture or facts and science. As you hit 40 and you had your life, your whole life, that those experiences that you've encountered is your crystallized intelligence. What did you learn from going to school and being married and having a baby? Those are also crystallized intelligence because it happened through experience. And it's kind of in the past. It's what you've learned. You've taken that knowledge, you've stored it in your brain, and you pull it up to make decisions in the present. But it's crystallized intelligence, whereas fluid intelligence is in the moment. It's changing, it's abstract, and you're thinking on your feet. So that's how you can kind of think of the difference. So this is a figure of fluid and crystallized intelligence. So you can see that the red is test of crystallized intelligence. The orangish color is test of fluid intelligence, and then the purple is just general IQ test. So note the opposite developmental patterns for fluid and crystallized intelligence. Fluid and crystallized intelligence, they follow different paths developmentally. So fluid intelligence, so that's that quick thinking intelligence, right, declines throughout adulthood, that abstract thinking, that inductive reasoning. Whereas crystallized intelligence, that's knowledge about specifics through life or education, improves, right? Because you're always learning new knowledge. You're laying that down. So they do not understand fully why fluid intelligence decline, but it may be due to the underlying changes in the brain. Neuroscience research indicates that white matter, integrity in the brain during adulthood and late life is related in complex reasoning, flexibility in thinking, and speed of processing. And as you age, that white matter declines. It degenerates. In contrast, the increase in crystallization intelligence, that is until really late in life where all memory kind of starts to decline, indicates that people continue to add knowledge. So you're always continuing to add knowledge every day, which may be reflected in continual development of neural networks. So just remember that it can be based in science, and that fluid intelligence, so that abstract thinking declines as you age, and knowledge-based, fact-based, experience-based, crystallized intelligence actually increases as we age until both kind of normalize late in life, where they both decline. Another video and additional and explains the difference between fluid and crystallized. I know it can be confusing, so it's a great example. Watch this so you can see it in action. So thinking back to that figure we looked at with fluid and crystallized intelligence, what can we conclude? So we know that learning becomes more difficult with age. Either way, it still becomes more difficult. That intellectual development varies depending on the skill, and that crystallized intelligence is easier to acquire than fluid intelligence. So what they found as one of the reasons is that few adults get much practice in solving complex problems to maintain their fluid intelligence. They just aren't exposed to it. So that old theory that if you don't use it, you're going to lose it. So one of the things that we talked about as we get into those later stages is how do we create activities that stimulate the brain and keep those active so that they can maintain their fluid intelligence. But one thing that we do know is that we are always obtaining new knowledge on life every day. So increases in our crystallized intelligence. So what does the neuroscience research intelligence in young adult and middle adult, what does it say about it? So what they found is that specific areas in the brain are associated with intellectual abilities, and that developmental changes in these areas are related to changes in performance, right? Makes sense. So we have, our brain is wired to control specific areas, and as we develop, these changes in these areas are related to changes in performance. So as we age, if they decrease, we're going to have decreased performance. So if we're going to look at the PFIT theory, so this would be a neuroscience research theory, the parieto-frontal integration theory believes that intelligence comes from a distributed and intricate network of neurons in the parietal and frontal lobes, and that individual differences in brain structure and function account for differences in intelligence. So they're talking about the actual communication between the parietal and frontal lobes, and when this network of neurons starts to age, that you're going to see differences in brain structure and function, and that's what's going to account for the difference. I want to record this again. So now we're going to take a look at neuroscience research view on intelligence in young and middle adulthood. So what the neuroscience view is that specific areas in the brain are associated with intellectual abilities. So developmental changes in these areas are related to changes in performance. So if you have a degeneration in the brain in these specific parts, you're going to see a difference in intelligence. And individually, you're going to see differences in, if you see differences in brain structure and function, if you take a bunch of MRIs or PET scans and you see them individually, you're going to see this integrated network of neurons in the parietal and frontal lobes. And if you can look at them and you see the way that these neurons work, they believe that that connection is where you're going to see, it's going to account for why you have differences in intelligence. And that's called the parieto-frontal integration theory, PFIT. And intelligence comes from a distributed and integrated network of neurons in the parietal and frontal lobes. So depending on the way that network is integrated, some people are going to be more intelligent, and if it's not integrated well, some people will be less intelligent. And if you're seeing a degeneration or change in that as you age, may account for why you're seeing those changes in intelligence. So that's the neuroscience research view on intelligence in young and middle adulthood. So this figure is brain imaging, which research indicates that active connections between the parietal, so you can see the parietal there in the back part, and you can see the frontal in the front part labeled. And the brain imaging research indicates that active connections between the parietal and the frontal lobes, shown in the colored areas here, are key to understanding intelligence. Specific areas of the brain are associated with intellectual abilities, and that developmental changes in these areas are related to changes in performance, right? That's what we discussed. There are 37 studies of various brain images concluded that the parieto-frontal integration theory, the PFIT, that proposes that intelligence comes from a distributed and integrated network of neurons, as we can see in the parietal and frontal lobes. And this accounts for the individual differences in intelligence as having their origins in individual differences in brain structure and function. Intelligence comes from the brain and varies from person to person, depending on the development of each individual area of these parts of the brain. So they looked at it and how much it lit up when they did different tests to see if the connection between the parietal and the frontal is strong. So they, as they were ask questions or showing pictures, they could see where it was lit up, and they could kind of test intelligence that way. So the results of the test of this theory support when measuring fluid, crystallized, and spatial intelligence using MRI. Also, performance on measures of specific ability is likely related to specific combinations of brain structures. So remember that the parietal lobe is at the top of the head, and that the frontal lobe is behind the forehead. So it's the top to the forehead, and it's those connections. that make up the intelligence, according to the neuroscience research. Going beyond formal operations, thinking in adulthood. So the question we want to ask, do adolescents differ from young adults in their thinking? So yes, adults' thinking shows post-formal thought. So the correct answer, it varies from situation to situation, right? Solutions must be realistic to be reasonable. That's an indicator of a different type of thinking, that post-formal thought. Ambiguity and contradiction happen regularly because that's life. They understand that concept. And emotion and subjective factors plays a role in thinking, right? We can't just always be analytical. How many times have you been thought with your emotions, or what has been said has played a huge influence on you? So adults definitely show a different type of thinking. It's kind of a post-formal thought. Remember, adolescents tend to approach problems in a formal operational way. Their basis is on right and wrong, the experiences, and they're logically driven. Older adolescents and young adults are reluctant to draw conclusions based on limited information, especially when the problem can be interpreted in different ways. So it's a higher way of thinking. So they realize that not everything is what it seems. Things can be, different, have different conclusions based on who told you and based on the environment. They ask a lot of questions. They point out missing information. They add in many different scenarios to come to the same conclusion. They consider multiple aspects of the situation that go well beyond the information given in a short problem. They start to begin post-formal thought. And post-formal thought is characterized by a recognition that truth, and that would be the correct answer, may vary from situation to situation, that solutions must be realistic to be reasonable, that ambiguity and contradiction are the rule rather than the exception. So most of the time things just aren't straightforward. And that emotion and subjective factors usually play roles in thinking. And the research indicates these origins are in young adulthood. So they're changing that adolescent, which is a lot of basis on right and wrong and experiences are logically driven, to where we become adult, where we realize life isn't always what it seems. Things aren't black and white. Things can be ambiguous. You can get the right answer many different ways. You can fill in the holes, ask the questions. So know the difference between formal and post-formal thought and why that is important and how that changes from the adolescent to the young adult mind. So now we're going to go beyond formal operations. So we're going to look at that emerging young adult, and they're going to begin this process of reflective judgment. And it's the way in which adults reason through real life dilemmas. So now we begin that higher intelligence, that higher thought process, that we actually start to logically think through real life dilemmas. And it follows a systematic progression. Stages 1 through 3 are pre-reflective thought, no acknowledgement or perception of knowledge, being uncertain. And during this phase, they may realize that some problems exist that do not have an absolute correct answer. So you're knowing that there is not one theory to development. So knowing that would be a stage 1 through 3, knowing that there's more than one theory to development. Stages 4 and 5 is quasi-reflective thinking, and that's the belief that knowledge is subjective. So what that can mean is that nothing can be known for certain, and conclusions are based on the situation and evidence, and each person is entitled to their own view, and that you cannot force opinions on others. So that's that quasi-reflective. Knowledge is depending on who you're getting it from, and everybody's going to have a different perception. And then stages 6 and 7 is true reflective judgment, and that is evidence and arguments are used in conjunction with analysis of the problem situation. And that's understanding that people construct knowledge through using evidence and argument after careful analysis of the problem or situation. They're continually reevaluating beliefs with new evidence. So they're always looking at the facts and looking at new evidence and changing their argument based on that. So this is, remember, it's systematic. So it's a progression through those stages. You don't jump through each one. You progress through them. People are able to think at complex levels, but most don't. Because the environment does not provide the support necessary for using their highest level thinking, especially for issues of knowledge and experience they already have. So something's easy or we have a lot of knowledge of it, we don't always dive deeper into it. And so maybe we're not really looking at things from the correct perspective. We're not, we become narrow-minded. We don't take that full journey of reflective judgment or thinking through real life scenarios. So the example they give is you may not purchase the car with the best environmental features, even though you know that it's the best car for the environment. And you are a strong environmentalist and you really, really believe in being an environmentalist, but the practicality of charging, stopping, frequently going out of your way, it has an impact on you. So you're just like, the convenience, I'm not going to do it. Even though I truly am an environmentalist, I still am not thinking that higher reflective judgment because how it fits into my lifestyle. Now, a way that can change, so if I looked at it and looked at the evidence and I said, oh, well, maybe if they had better charging stations or, the cars could charge longer and I could drive longer, then maybe I would do it. And I would start reflectively, looking at the argument and finding solutions. But, even the people that, the best intentions may just kind of go into what's easier or convenient and not go through this whole thought process. But it's definitely something in adulthood, to higher level thinking, that reflective judgment. And remember, it's a systematic progression. Another video that shows a really great example of reflective judgment that will make it very easy for you to remember for the test. So now let's take a look how young adults integrate emotion and logic in life. So we're going to ask the question, how do young adults and middle-aged adults differ in their views regarding an emotionally charged issue? So integration of emotion with logic, you make decisions based on emotions more than intellect as you mature into adulthood. Rules and norms are viewed as relative, not absolute, so they can change depending on the situation or the person. Mature thinkers realize that thinking is inherently a social enterprise that demands making compromises with people and tolerating contradictions and ambiguity. So it means that not everything is black and white. You have to compromise and you have to look at the situation, the environment, and make decisions off of that. Late adolescents view an emotionally charged issue such as an unethical behavior at work as inexcusable. They're more black and white, right? It's wrong or right. Firing the only outcome, whereas a middle-aged adult may take into context factors that may have been forced, that may have forced a person to engage in that behavior. Middle-aged adults are better at integrating emotions into their thinking. So the big key to take away here is that young adults tend to be more, black and white. They tend to see things as, consequences should be directly related to your actions, whereas middle adults, they have more experience. They can take in the emotion and kind of block that out and look beyond what was the action, but why did you do it? Maybe you did something unethical because your child was sick and you were so desperate to get your child to the hospital. So they may look at that and see the bigger picture, and remember that they're better at integrating emotions into their thinking. So middle adults are better at integrating emotions to thinking, and late adolescents, early adults view emotionally charged issues much more black and white. And that life cycle forces and cohorts effects influence the integration of thought, emotion, right? So that's that example. So if you're early, remember that life cycle is, timing is everything. So if you're looking at that situation and we talk about that unethical work activity, you're going to look at it differently if you're 20 opposed to if you're 40. So remember that specific situation encountered results in emotional reaction and related goals triggered. And that integration of cognition and emotion, and then it responds in a social judgment made. So age difference exists in regards to social cues and evaluations evoked in different types of situations. So we're going to look at the figure on the next slide for different age groups, social rules, and evaluations regarding marriage and career. But what this is showing is exactly what I was talking about in the slide before, about that judgment call on that unethical behavior. So you have that situation, that unethical behavior. You're going to have an emotional reaction, and your goals are going to be triggered. Where the adolescent or young adult may say they should be fired, the adult may like, look at all these different scenarios and say, why did you do that? So they integrate their cognition and emotion differently. A young adult's going to be more emotional. A older middle adult is going to take the emotion more out of it and look at more the abstract thinking of it. And then because of that way they think, they're going to make a judgment. So the middle adult would make the judgment of, maybe I'll look in and ask why. Maybe there was an emergency. Maybe something else outside that caused them to make that unethical decision. Whereas a young adolescent, as an older adolescent or a young adult may just see it as black and white, say you did an unethical behavior, I don't care why, you're fired. So that is what they're talking about when you're going through that process, and the age difference is important in looking at what you value in your social rules and how you evaluate the situation and the emotions evoked by the situation. So this figure shows integrating emotion and logic. And as you can see, the red is the young, green is middle age, and blue is old age. And it looks at romance and family. So we're looking at age differences in responsibility blame attributions for traditional and non-traditional characters within romance and family vignettes. So responsible and blame items for each vignette or situation revolve around a range: relationships, breakups, decisions to marry, and family, which may include parent-child conflict, autonomy, caring for an older parent. So how much you think that person is responsible for the outcome is highly correlated with blame. Middle-aged and older adults assign more responsibility and blame than did younger adults. Reason could be generational differences influenced whether strong family social rules, how cognition and emotion interacts, would be activated. You can also see different life stages of the respondents. Pressures in middle life to provide for a child may bias their answers. And social beliefs, as expressed through social rules and evaluations, are powerful influences on how we behave in everyday life. And developmental shifts in the integration of cognition and emotion is an important determinant of age difference in social problem solving. So one of the big questions in young adulthood, which a lot of you are going through this right now, is who do you want to be? And how do you figure that out? The personality in a young adulthood. This is when you really start to find out, what kind of person do I want to be and how do I get there? So we're going to look at what is the lifespan construct and how do adults create scenarios and life stories? What are possible selves? What does that mean? Do they show differences during adulthood? Do you change? Am I going to be somebody different when I'm 40 than I was when I was 20? And what are personal control beliefs? So let's take a look at these. So creating scenarios and life stories. How do we do that? Well, according to the lifespan construct, it's a unified sense of past, present, and future based on personal experience and input from other people. It represents a link between Erikson's notion of identity, which is the major force during adolescence, right? It's that identity, and our adult view of ourselves. So it's kind of linking that. How did I figure out who I was when I was an adolescent? And now how do I view myself as an adult? Am I saying that same person? It's manifested through scenarios. So expectations about the future. So an example, here's the social clock. Tagging future events with an age or time in which they will be complete. So I'm sure you've said, you've heard people say, I'm going to make 6 figures, like this one says, by the time I'm 30, or I want to be married with kids by the time I'm 27. So you're putting that case scenario or that future expectation of what you want to be to create these, lifespan constructs. Am I going to bring my past and my present to create this future based on what I want and what I have done and the opinions of other people? So remember, when you're creating these scenarios, you want to play out and take aspects of the person's identity that are important to them and project them into a different scenario for the future. And the social clock allows a personal timetable to track the progress of the scenario through adulthood. And I'm sure I know I've had, certain things, ideals that I wanted. And now looking back at it, I think they were ridiculous scenarios to want. I limited myself. But we do this as young adults. We create these scenarios because we just want to get to our adult life. And how do we create these goals that we have? So it's very goal oriented and future thinking, that social clock, that lifespan construct. Another additional video is going to talk about the narrative identity and the meaning of it and a good way to remember it for the test. So let's take a look at that narrative identity and see what it's all about. So again, we're still creating scenarios and life stories. According to McAdams, a person's sense of identity is explained through his or her life story. And a life story is a personal narrative that organizes past events into coherent sequence. It's basically the autobiography of your life as we move through adulthood. Every episode provides insight into perceived change and continuity of life. Either the person changes or remains the same by pointing to specific events that shape these changes or non-changes. So you're integrating these changes, and maybe you're more challenged as you go through adulthood into midlife and later in adulthood. So your personal narrative is how you take these changes or lack of change and how that becomes your personal, story. All life stories need an ending through which the self is able to leave a legacy that creates new beginnings. Life stories in middle-aged and older adults have clear quality of giving birth to a new generation, which is essential to Erikson's idea of generativity, which we'll talk about when we get to middle age. So as what it's basically saying is, this personal narrative, as you go through the stages of development, it's going to change. You're going to have, the content is going to be different. And as you get into later, you're going to be looking at the ending. And again, and that ending usually has some aspect of passing on knowledge to the younger generation. So the goal is to create a life story that is coherent, credible, open to new possibilities, richly diversified, able to reconcile opposing aspects of oneself, and integrated within social-cultural contexts. So you do this, both consciously and unconsciously. You want to leave a, legacy that creates new beginnings by passing it to your children. You're going to have main characters in your life that represents your ideals of yourself. And this, these life stories prove to yourself and others that the person has changed or remained the same over time. So basically, like I said, it's your autobiography of your life. And in different stages of development, it's going to mean different things to you. As a young adult, you're creating new things. I'm in middle adult. I'm thinking about, retirement, but I'm also thinking about the shaping forming my daughter's early years, and then it's going to change when I get to later. So that's your personal narrative. Now let's take a look at our possible selves, which is a representation of what we could become, what we would like to become, and what we are afraid of becoming. So what you're going to look at is, what do you think you'll become in a few years? It's going to reflect your personal goals. Do you see yourself as a leader, a risk taker, famous, or physically fit? So age difference determines what we see for our hopes for ourselves. So as you can see here, young adults in their 20s are concerned with family and marriage. Adults in their 30s are concerned with personal issues, becoming a better person. Family issues that focus again in the ages between 40 and 59 as you transition, from, not having a family and retirement. And then personal concerns are more prominent for your 60s. How are you going to take care of yourself? What are your long-term goals as an older adult? Staying healthy, being active. So what they found is that through this discovery of your possible selves, our potential selves are powerful motivators to achieve goals and avoid various obstacles while protecting current self. So you want to become this person. So because you want to become this person, you're less likely to maybe do behaviors that would limit you. So if I want to be, have a baby, I'm probably not going to start smoking. Or I want to, have a family and marriage, maybe I won't date around, too promiscuously. So those certain things may cause you to change your behaviors and maybe avoid certain obstacles because of these goals. And again, you want to have success in occupation career for 40 to 59-year-olds. 60 plus, you want to be healthy and active. Online social media has created opportunities for young adults to create possible selves and speculate about other selves. So that can be a good thing and a bad thing, right? Overall, young adults multiple possible selves and believe they can become their hoped for self and successfully avoid feared self with a positive outlook. So, you have your feared self. I won't be successful. I'll never find someone to marry. I'll never find that dream job. But if you believe in your hope self, you can avoid those feared self. So you can avoid that feared self-positive outlook. Older adults are more likely to believe that neither the hope for nor the feared self is under their personal control. So they're more negative outlook. So basically, young adults are a more positive outlook because they believe that their hope self can successfully avoid their feared self. And older adults are like, you know what? It doesn't really matter. My feared or my, hope self, I have no control. So they have a more negative outlook on life. So if you want to know for the test, remember, younger adults have a more positive outlook of their possible selves, and older adults a more negative outlook. So again, young adults' outlook regarding possible selves tend to be positive. Number of possible selves and belief that one can become or avoid a possible self decreases with age. And so I want you to think about, how does online social media play a role in young people's creations of possible selves, right? Tons of outlets to find that possible self, right? Tons of new ideas with these of marketing yourself. I mean, right now on social media, people's business is themselves, right? And this idea of what this possible selves are. So can you think of that role that social media plays in a young person's creation of possible self? So now let's take a look at personal control beliefs. So remember, this emerging young adult is starting to gain some of that personal control. And what that is the degree to which you believe your performance in a situation depends on something you do. For example, believing you didn't get fired for a job because you interviewed poorly versus the company failed to pick the best person for the job. Successful people show a high sense of personal control to show that they are in charge. And the developmental course of personal control depends on the context of the situation. So basically, you're asking, is it due to your own control or luck or the powers of others? And a high sense of personal control is a belief that performance is up to you. A low sense of personal control implies that performance is under the influence of forces other than yours. May it be luck, your friends, your boss. Successful people demonstrate a high sense of personal control and exude authority. So they take control is up to them, It's due to their own control. Personal control can be applied to several domains such as social networks, health and career, and is nearly a universal desire to make a difference in the world through one's own life. So think about your personal control. Do you have a high sense of personal control, or do you have a low sense? Are you somewhere in the middle? So now let's take a look at primary control and secondary control when we're thinking of these personal control beliefs. So the motivational theory of lifespan development breaks this down into primary and secondary control. And primary control is a behavior that is aimed at affecting the individual's external world. Secondary control is behavior or cognition aimed at affecting the individual's internal world. So primary is influenced by biological factors such as stamina. Can I work 2 jobs? So it changes, so it changes over time. So when I'm young, I may have a lot of stamina and I can work 2 jobs. It's very low influence in childhood to high influence in middle adulthood and very low again in late adulthood. So again, you're looking at primary as how's my behavior, does it affect my outside world? and secondary is my behavior, cognition, affect my internal world. So Jill got a second job in order to increase her earnings. Which type of control is she exhibiting? So Jill is demonstrating primary control because that's affecting her external world. It's more biological. Does she have that stamina to work 2 jobs? So that would be an example of primary control. So this figure looks at the hypothetical lifespan trajectories for primary control potential and primary and secondary control. So first half of life, primary and secondary control is striving to operate in parallel. During midlife, primary control capacity begins to decline, but secondary control striving does not. So desire for control does not change, but differs with age is whether we can affect our environment or whether we need to think about things differently. So that is the end of chapter 10. So we're looking at that emerging adult. Look at those extra videos. It'll get some great examples. And I'll see you for chapter 11.